Hello, welcome to yet another session of Ask Me Anything. So, these sessions happen every Tuesday at 9 p.m. Indian Standard Time on my YouTube channel. So, normally what happens is I talk about a subject for about 5 to 10 minutes and then it's open to questions. You can ask questions on the topic which I spoke, or any other thing also. And I'll be answering those questions to the best of my capacity. Okay, so today we are coming up with Abhyanga or massage, as mentioned in Ayurveda. Not gonna go in deep, but an idea about how Abhyanga is being done in Ayurveda. Okay, so shall we start? Yes, Karthik, Namaskaram. So here we go. Okay, Abhyanga or massage in Ayurveda. Now, massage is basically called Abhyanga in Sanskrit. Okay, and when you go Abhyanga, with the angas or the organs, the limbs, it's called Abhyanga. So primary understanding is oil massage, where generally people, when you say Abhyanga, massage, they understand it as oil massage. And it is something which has to be done daily. Abhyangam acharet nityam. That's what Ashtanga Hridaya says. That means every day. Okay. Now, let us see what are different kinds of Abhyanga and how do we do it. Now, okay, Abhyanga Majaret Nityam and Shirashravana Padeshu Visheshena Tam Shilayet. The sense head, ears, and feet. Visheshena, specifically, you have to do massage. So, if you're applying oil on the body, you can apply oil on. If you massage your body, well and good. Even if you're not able to massage your body really well, apply body all over the body. Apply the oil all over the body, but focus more on the head, ear, and the feet. Shirashravana padeshu visheshena tam shilayet. Okay, and if you do Abhyanga on a regular basis, what do you get? Okay, it Jara, that means it slows down aging. That means the process of aging is very smooth. It's not that you will not age or you will not die, but the way you actually get into old age is much better. Shrama, it removes tiredness. You know that once you have walked a lot and come back and somebody is there to massage you, you'll feel really great, right? Vata, Vataha, it subsides Vata. Drishti prasadanam, it promotes your eyesight. That's why we say apply oil regularly on your head. Pushti, it promotes nourishment and strength. Ayu, your well-being, your life itself becomes worthwhile because you become very healthy. Nidra, you know that if you have gone for a good massage and you come back, you really sleep well. Okay. Sutwak, twak is your skin. Sutwak means your skin becomes very good. Dadhyatwak, sutwak dadhya krit, it says, that means your skin becomes, su means soft or good, and dadhya means it actually gets tighter. Loose skin and all will start getting tighter if you do massage or abhyangam regularly. Different kinds of abhyangas are there. Okay. So as I said, Shiras, Shravana, Padeshu. Shiras, Shravana, and Pada, you have to do specifically. That's what Ashtanga Hridaya says. Now, in what are conditions you are not supposed to do Abhyanga? Varjo Abhyanga Kapagrasta Krita Samshuddhi Ajirnavihi. Okay. So if you have got more of kapha, that means you have got more of, I don't want to use the word phlegm. Okay, when you have got excessive kapha roga, like running nose, or you have got cold, or it can also be ajirna. Okay, you have got indigestion, you have consumed food and stuff like that. You are not supposed to do abhyanga. And krita samshuddhi, immediately after you have done shodhana, you have done vamana, virechana, vasti, or whatever it is, you are not supposed to do any abhyanga. ajirna, as I said. Because some should ajirna be when you've got indigestion, you are not supposed to Abhyanga. That means immediately after food, or you have got indigestion, you've got loose motions and stuff like that, you cannot or you are not supposed to do a massage. Okay. Now types, consistency wise, you have got wet massage that's with oil, and you have got dry massage that is udvartanam. We use powder massage, that's called udvartanam. Okay, direction, okay, it is anuloma or pratiloma. That means anuloma is following the direction of the hair, and pratiloma is against it. And pressure, you have got different kinds. You call Abhyanga is basically decent amount of pressure, and Samvahana is application of oil and massaging it really well. In the sense, you are not using too much of pressure, especially for elderly people and for children. We do more of Samvahana rather than doing Abhyanga. Okay, so you can start asking your questions. It's okay. Okay, so this is what generally Abhyanga is all about. So now, see, when you look at Abhyanga or application of oil is a part of Snehana. In the sense, when you're preparing a person for Panchakarma, also you do Snehana. Snehana is two. One is Bahya Sneha, external, and second one is Anta Sneha. That means you're giving ghee or oil internally. You can do both. Bahiranta Sneha also you can do. So you can apply oil on outside, and you can also make the person consume ghee. So now you can start asking me questions. I see Cynthia has already asked a question. Yeah. So do we go towards the heart or follow direction of hair growth? Where is it? Okay. Sorry. Do we go towards the heart or follow direction of hair growth? So hair growth is basically called anuloma. If you look at your hand, you will see the direction of hair growth. So if you do massage along with the direction of hair growth, that is basically nourishing. Okay, it helps the blood flow really well, and the skin gets tighter and stuff like that. So normally when somebody says Abhyanga or massage, it is always anuloma. And other one is pratiloma. Pratiloma is against the hair growth. That means you're going upwards. And what happens when you're going upwards, especially when going upwards is basically denourishing. Okay, so there is something called Udvartanam. Udvartanam Kapaharam Medisa Pravalayanam. Okay, it reduces fat. So that is generally done. You saw that dry massage, that is using dry powders. It is done pratiloma. It is done against. Okay, so Udvartanam is done against, while Abhyanga is done with the flow of the hair growth. That is anuloma, and this is pratiloma. So anuloma is nourishing, while pratiloma is denourishing. Yeah, Cynthia, the question came a bit too early. No problem. Okay. What is the typical amount of oil required for an adult for Abhyanga? Is it 15 ml or 30 ml? Just asking to make sure I'm not applying too little or too much oil. I would say 10 ml of oil, 7.5 to 10 ml of oil is enough for somebody to apply on the head, Kamalnath. Okay. To be able to understand that. But it also depends upon how much of hair you have got. That's why I said 5, okay, say probably 7.5 ml to, or maybe 5 ml to 10 ml on the head. But on the body, I would say nothing less than 50 ml. Okay, so you have to really apply well. If you're very thin, then 50 ml is fine. But if you are slightly fat, and men sometimes have a lot of bodily hair, if there's a lot of bodily hair, then you always have to use more oil. So it depends from person to person. It depends it differs the size of the person, season wise also. If it is very, very cold, you might not feel like taking too much of oil. A little bit of oil would be enough. Okay, so it depends. But by and large, I would say don't go below 50 ml. Okay, that should be decent. Kamalnath. Applying oil to ear is applying around the earlobes or inside the ear. It is basically inside the ear. Okay, around see when you say the body, around the ear and all is body part. Okay, but when you're pouring into the ear, in the sense you don't pour like that. Okay, For Karnapurna, which is again a treatment procedure, we pour oil, we warm the oil and pour into the ears. It is amazing for a lot of ear disorders. But one thing what you have to do is you have to check whether the person has got a perforated eardrum. If he doesn't have, it is fine. But if he's got an eardrum which has got a hole, if you pour oil or anything, it will go into the middle ear and can cause infections. So that's something which should be very clear. So when a patient comes to us with ear issues and we've decided to do a Karnapurna, we get his ear checked to see if he has got any middle ear infection or if he has got a perforated tympanum or an eardrum. Okay. If it is there, we avoid, or otherwise, oil has to be applied into the ear. Don't pour one drop of oil, you're putting inside the ear and rubbing it. Okay. So when you do it on a regular basis, daily, you get the cumulative effect of the oil. It's not that the oil will go inside and do something. The effect of the oil, okay. Oil reduces vata, it is snigdha, it is ushna. It works really well because this is vata sthana, okay. Ear is vata sthana and you are trying to pacify it by applying oil. Okay, where's the next question? Is Abhyanga more of lymphatic massage or deep tissue massage? See, let us not confuse it as lymphatic massage or deep tissue. Deep tissue massage is more of, you can use extreme pressure where some people want it, but we don't recommend that you go through something which is very deep, especially if you are going through a one day massage and somebody does a deep tissue massage. There is always a chance. Say suppose you are on a vacation, you go and you do a deep tissue massage, your next 2-3 days might not be very comfortable. You'll feel sore because you break a lot of small capillaries and tissues, and it takes time for it to repair. So we don't recommend that too much. I would say it's always good for you to do a normal medium pressure massage, but keep on doing it regularly so that, as I said, the cumulative effect is always good. Like when a person comes to us with stiff neck, when they touch, we'll see that, the person has got knots over here. If we try to break that knot in one sitting, the person, so much of pain, and the person might develop fever also. So what we do is we keep on doing it. It will take about a week sometimes. Locally, we keep on doing it, do it for about half an hour, ask him to go and come back. Next day, you again do it, or you can do it in the morning and in the evening. So slowly, you apply pressure and start breaking the knots. That would be the right approach. So deep tissue massage, some people say they love it, but I don't say it is something which is good for the general public. Karthik. Few months back, I came to know about Abhyangam from Weekly MA. It is really supportive for me. Vata Prakriti, thank you. Yes, it's all His grace. There's nothing new which I've told you. It's all from the text. So I try to quote from Ashtanga Hridaya. So Ashtanga says the same thing. It is Vataha. Okay, it pacifies Vata. Okay, it gives you strength. It makes you sleep better. Pushti ayu tushti. It gives you strength, nourishment. Everything. So Abhyanga is something which you have to do every day. Abhyanga macharit nityam. Sa jarashrama vataha. Okay. It slows down your aging. It makes you feel fresh, and it gives you a more meaningful life. Okay. Great. Thanks for that share. Padabhyanga, which case is more useful than general Abhyanga by hand? Okay. Padabhyanga here, I don't think he meant Abhyanga on the leg. He meant you do massage with the leg. Okay, I think that's what he means. The sense the person is lying down on the floor or on the mat, and the person who's doing massage is standing up, holding a rope, and then massaging with his leg. Okay, so here, normally Ayurveda, very rarely you see extreme kapha conditions or medo condition. We say do deep tissue or with your leg. But generally in Kalari, okay, where the martial arts, where they need the body to break down and your flexibility has to really go up. people undergo that, and even Kathakali artists. Okay, in Kerala, the art form Kathakali, the males, not the females, the males undergo. We call that chauti tirma. That means chauti means to stamp and do the massage, so that the person does not. Some people feel that the person will stand on the person who's lying down. No, so he stands on the ground. He's holding a rope for balance, and with one leg he's massaging. He doesn't stand on the person. Okay, so that is specific conditions, but generally speaking, it's always good to do with the hand because you have got more control. Okay, and that much of pressure is more than enough. And when people undergo massage with the feet, we'll see boils come on the face, on the whole body because of the heat that is being generated. So those are specific conditions, and only very much under medical supervision, and whether you are fit for that is again a question. Okay, Sitaram. If exercise is not pachana, then why walk after eating? Normally, Tejas Shrimati, it's actually a very good question. Okay. You see, Laghavam Karma Samarthyam Deepto Agni. Exercise only Deepto Agni. It only makes you feel hungry, but it does not help in digestion. So walking after food, yes, you know what has been told? Mitam bhuktva shatam japtva. Mitam bhuktva means eating little. Mitam bhuktva means after eating. After eating little. Shatam japtva. After doing japa for 100, that means 100 japa you're doing. That means you're sitting for some time. Mitam bhuktva shatam japtva gata shatapatam. You're walking 100 steps. Ayurveda does not ask you to do exercise after food. No. Okay, I'll tell you one reason. So after food, what happens is, to digest the food, you'll notice that the blood supply actually rushes into the stomach, and that's the reason why you feel slightly drowsy also after food, because there is not too much of blood supply in other parts of the body. There is something which is not a part of the body, foreign body in the form of food has gone inside, so that has to get digested. So blood supply completely focuses on in the abdomen, in the stomach. So at that time, when you start walking and doing exercise, your muscles start moving. They start getting sore. Automatically, to repair that, blood supply has to go to the feet or to the hands or whichever part of the body you are moving as exercise. That is not good for digestion. You can walk so that the food settles a little bit of walk here. You can just stroll here and there a little bit, but don't do exercise after food. Doctor, but when we do self-abhyanga, the strokes are generally up and down both ways, which goes in and against the directions of hair growth. So what do we make of nourishing or denourishing? See, when you are doing yourself, generally speaking, I would not see. We do this. We apply. So you can bring the hand up. Okay, you can just bring it up superficially, but when you're massaging it, it's always good for you to do it downwards. Okay, but there are specific conditions I can give you, like varicose veins. The abhyanga is done pratiloma, because you want the blood which is getting stagnated in the feet to start going up. So the massage is normally done upwards. But generally, even when you're doing self massage, I would say, if you apply pressure downwards, and then bring your hand casually upwards and apply pressure downwards. Okay, that would be a better way of doing it rather than rubbing it up and down. Okay, hope that is clear. Next question. Best oil to do abhyanga in rainy season. Okay, in rainy season, what? Chaya prakopa prashama vayoho grishmadishu trishu. Chaya prakopa is going up. Chaya is accumulation, prakopa is going up. Accumulation of doshas and doshas going up, and then they automatically coming down. These three things happen always. So in Grishma, or in the summer, what happens is Vata dosha accumulates, and in Varsha Ritu or this rainy season, the Vata actually goes up. Okay, next season after the rain, Sharad, it slowly pacifies. Automatically, you don't have to do anything. That's the way nature is. But if you keep on indulging in activities which will increase the Vata during the rainy season, rather than it coming down automatically, it will start taking off. So that is a problem. So you should understand that in rainy season, the vata is slightly high, okay, and the body is susceptible to a lot of issues. Plus, it is also extremely welcoming to a lot of treatments. That is the reason why in Kerala, we actually focus a lot on Karkataka Chikitsa or treatments, general treatments for rejuvenation and for, other things. Even if you've got issues also related to Vata in during the rainy season. So if you don't have any issues and you want to do Abhyanga uh, during the rainy season, I would recommend that you use Dhanvantaram Tailam. That is more than enough. It will take care of all your Vata issues. Dhanvantaram Tailam. Warm it, apply it really well, wait for 45 minutes, and then take a shower in warm water, not hot water. Yes, ear oiling does help with tinnitus. Normally, in tinnitus, you'll notice that there's a ringing sound, and ringing sound basically is because of whether there is an emptiness and also what you call a hollowness in the head. Okay, it is basically denourishment. So, along with dropping oil in the ears, it is good for you to drop oil in the nose, applying oil on the head, and also doing oil pulling. So, what happens is you can also apply ghee in the eyes at bedtime. So, here what you're doing is you are trying to fill every orifice with oil to get the vata under control. It works really well. It is also good for vertigo, all these things, so that's the reason people who apply oil regularly on the head very rarely get disease like tinnitus or hard of hearing, stuff like that. So apply oil regularly on the head, ear, nose, eyes, both, whichever, however you want to do it. For tinnitus especially, we try to fill every hole with every orifice with oil. Okay. Yes, Sahaj, I've already answered that. Pumpkin or ash god, is it good to consume freshly harvested or use after stored for months? Ash god or something, Valli phalanam pravanam kushmandam vatapittajit. Okay. Kushmandam or ash god. Valli phalanam. Valli means creepers. Valli phalanam. Of all the fruits which grow on creepers, Valli phalanam. Okay. The king of all those is Kushmandam. Valli phalanam pravaram. That means the best is Kushmandam, that's ash god. Okay, and it is extremely good. But the good thing is that that can be actually stored for a year or so. So you need not, because what happens is when it harvested, a lot of ash gourd or pumpkins will actually be harvested, and a pumpkin is not as good as ash gourd, because pumpkin actually rests on something and then it grows. That's the reason why it will increase kapha beyond a certain limit, because it was always resting. But if you look at ash gourd is not something which is resting; it is hanging. Okay, and if you notice, something that is hanging cannot grow beyond a certain size or weight. So if it grows beyond a certain weight or size, what happens? It will automatically fall off from there, right? So that is suicide for the fruit. It will never do that. It will stand there and start potensifying itself. It will not put on weight, but it will keep on getting more and more potent. That's why Kushmanda, ash gourd, is much, much superior than pumpkin. Pumpkin, okay, but not as good. Next one, yeah. My mother, Karthik, my mother is facing pain around the heel bone, and sometimes by night it becomes high. Currently managing by almost, I want to know what is causing it. It is basically, you know, probably, I'm just assuming that your mother might be slightly overweight. One thing. Second thing is that, she might be walking barefoot in the house, which I don't recommend people to do. Other days, olden days we used to wear, we never used to wear slippers at home. And when we go out, in the mud and all, we never used to wear. If you have going out only, we used to wear. But nowadays, what is happening? People at home, just like before, they don't wear slippers. So the floor is too hard and it is too cold. It can be tile or it can be marble or whatever it is. that is not good for the feet, especially when you age. Your vata goes up. This cold affects the bone. When it becomes cold, the vata goes up. Bones start losing their quality. One other thing is that people who are overweight, what happens is there's pressure from top because of the weight, and because the surface is so hard, there's pressure from bottom also. So there is always a chance of a spur coming out from the heel. It's called calcaneum spur. It can be treated really well, but most importantly, see that she keeps her feet and stuff warm, and she wears soft chappals even inside her house. This can be well taken care of. Medicines didn't work, but eating 50% stomach solved weak agni. I understand, but the thing is that, when we look into the treatment aspects, which I always tell people, how do you manage any condition, irrespective of whether you're healthy or unhealthy? It is ahara, vihara, vichara, aushadha. Ahara is the first thing. Your food is the first thing. Next thing is your vihara, your lifestyle. You eating half your stomach would have solved a lot of things. But if you don't sleep on time, if you stay awake at night a long time, and then probably you are sedentary, or you over exercise your work. I mean, as I said, your lifestyle, your problem, you'll find a different problem altogether. So the first thing what you have to do is you have to take care of your food, ahara. Next thing is your vihara, your lifestyle. Third thing is your vichara. Vichara is the attitude with which you are looking forward to life. Whether you are comparing yourself, stress basically. Okay, whether you are comparing with the person who's sitting on the other side. He's got a BMW. I don't have a car. He's got a flat there. He's got that. I don't have anything. He's got 2.5, maybe 1 crore package. I'm only getting this much. If you are in this mentality, so you're either anxious or you feel, oh, I should have done that. I should have taken up that job. That is a part of your vichara. So if your ahara, vihara, and vichara are balanced, okay, in moderation, then you don't need aushadha at all. Okay, but I'm telling you, any aushadha, probably I remember prescribing medicines for you for agni. So it only helps your agni get better. But at the end of the day, when you drink a wine, you feel that your appetite is good, you feel hungry, and you eat a lot. It is the wine that is kindling that agni. But if the agni has to be stable, then the amount of food you eat, then the lifestyle you lead, and the thought process all matters. Okay. So thanks a lot for that share, Tejashamurthy. So it's very important. Few months back, I have diagnosed with thyroid and goiter. Which dosha is imbalanced in this condition? It is very, very, very difficult to just tell you right away, because it could either be, if it is inflammatory, it could be pitta. But one thing for sure, it is kapasthana. The sthana where you have got the goiter is kapasthana. So 100% kapha is involved. So when we normally manage any thyroid issues, we see that initially we give something to get that kapha out of the equation. Then we try to balance the vata and the pitta. So once you go to a doctor, a good doctor, either doctor, and consult them, they will be able to guide you, because I'm telling just the principles behind it. It is kapasthana, 100% kapha is involved. Then what is the associated doshas? Then the treatment depends upon what the associated doshas are. Okay. I think it's Kalyani, right? Nasya, if not possible in the morning after a bath, then when is the next best time to do? Nasya, is steaming necessary before Nasya? If you can advise the right protocol to do Nasya. See, Nasya, generally, it is always good for you to do at about 10:30. Okay, if you're doing it on a regular basis, 10:30. I don't want it to be very, you taking a bath, your head goes very cold. If your head bath, okay, your head is very cold, and then do you do Nasya, might not be very effective. I always say you take a bath early morning, no problem. Nasya is always good when you do it when the sun is actually up. So might be when slowly when you're entering the pitta. So I think 10 o'clock, 10:30 is actually ideal for you to do pitta. Sorry, Nasya. And then if you are not able to get that window, then somewhere around 3:30, before it is extremely, it gets into the vata state. You got it right. So see, I know that 2 to 6 is vata, but still, about 2 to 33, it is the pitta still there, the sun is still there, it is still slightly warm. That would be the right time for you to do nasya. But always good to do it in the morning. But when you're doing it on a regular basis, it's not that you have to do steaming every time, but your body, your face can't be cold, because the moment the oil has to be slightly warmed and your face is cold, that oil cools down and it doesn't give you the desired result. Here we want it to get into the sinuses, clean everything, or nourish everything, right? So it's always good to be warm. If not steaming, at least heat the cloth and slightly tap it on your face and warm it a little bit. Stay away from air conditions and fans after doing a nasi. Wait for some time. So morning, I would say morning 10 o'clock, 10:30 would be the right time. Or you can also do it if you're doing it daily, getting up in the morning and doing it, maybe 9 o'clock also would be okay. Depends upon the city in which you live. Evening 3:30 also would be fine. That's a second option. Okay. Please, what does it indicate if one doesn't get good sound sleep after oiling hair at night and going to bed? Uh, First thing is that oiling hair at night and going to bed is not advisable in a general condition. Okay, because oiling increases kapha. The whole night is tamas and more of kapha. You have always got a chance of catching a cold. Okay, congestion might be slightly on the higher side. That could be one reason why you're not getting sleep also. So try to shift the oiling for the day in the morning, and you don't have to leave it so much, like 6 hours, 7 hours, 5 hours, 6 hours. You don't have to leave it. Get up in the morning, apply. But when you're doing it regularly, get up in the morning, applying oil, leaving it about for a muhurta, about 45 minutes, and then washing it is more than enough. It is you doing it on a regular basis consistently. Okay, that's one part of it. Second part is why you're not getting sleep is a question which you have to ask yourself. What food you're eating, what is your lifestyle, and what is your stress which you're going through. That also adds to sleeplessness. Only application of oil will not give you sleep. You try to address that also. But I would say applying oil in the morning is the best. I want I want to do langan for a week to cleanse my body. What foods to take? Okay, if you are vata prakriti, then langanam is something which you have to be very careful. Langanam is not fasting. Langanam is actually going down on the amount of food you eat. Okay, so here again, I would say let what you take be predominantly milk based. First thing, okay. And second thing, you can add a little bit of ghee also with it, even though ghee is not heavy, okay. So even though you are doing langanam, you should be very careful when you say you have got more of vata person. You cannot go out and do a lot of physical activities or exercise and stuff like that. You cannot at any given point of time stay awake at night. Okay. And whatever you're genetically used to, you can have. If you are langanam is probably cutting down your food by half. I think that's all you have to understand. Okay, it is not eating anything. So if you're somebody who eats 2 chapatis in the morning, make it 1 chapati. If you're somebody who eats 100 grams of rice, make it 50 grams. That's all. That's enough for you. Okay, and then you can do a little bit of oil application on your body if you want to, but not too much, and stay warm. Okay, let us not confuse what you call langhanam with fasting. It is not fasting. Okay. Abhyangam on calf muscles also need to be done in downward stroke. Normally, the stroke the calf muscles in the direction of the heart. No, Abhyangam on the calf muscle also need to be done only downwards. There is nothing specific about the calf muscles. I know that if the calf muscles work really well, the blood is pumped back into the system. Yes, that is by exercise and need not be by Abhyanga. So your job is to basically do Abhyanga downwards and relax the muscles and see that they are kept fit. But as I said, if you have got varicose veins in the calf muscle and stuff, then it's a different issue. The massage there is not to strengthen or not to loosen or tighten the calf muscles. It's basically to get the what do you call blood flow back. Okay, that's the reason why you do massage upwards. But otherwise, massaging downwards is more than enough. Abhyanga with bare hands versus with gloves or something, some therapists may not feel comfortable. Will there be any difference? Yeah, definitely. It all depends upon somebody's comfort. During COVID, there was this thing that people should not touch the other person and massage with gloves and stuff like that. Neither the person who is used to doing massage with the hands or the person who is used to getting massage with the hands are comfortable when there is a glove in between, a rubber glove in between. Okay, so I would not recommend any glove in between the patient and the therapist. It's always good to feel the person, feel the temperature, and we have seen that there are a lot of cases where the therapist is not able to feel the temperature of the oil, and that is not good for the patient. It can be too hot sometimes, it can be too cold also. He's not feeling anything. So it's always good. Skin to skin is always the best. Why Dhanvantara oil is famous for Abhyanga, even though so many types of oils exist? See, it is famous or not. It is something where it is widely. You can use it in so many conditions. It is something which is also mentioned for women after delivery also. Okay, Dhanvantaram Taila. It is very good. So you don't have to search for any other. So what all do I give for pregnant lady? What all do I give for old people? What? So you don't have to think in too many directions. So other oils are very, 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 very specific about a lot of things. It is not that this oil is not specific, but this oil can be used in so many other conditions. Varied application makes this oil very popular. That's all. Okay. It's actually, if you look in Ashtanga Hridaya, it is mentioned in Sharira Sthana when they talk about the body, when they talk about women who have got complications in delivery. That is where Dhanvantaram Tailam has been mentioned. Good evening, Ramesh. How do people in ancient times cut nails? It did not go ancient times. I remember my father also. Even though we used to have a nail cutter, he used to use a small knife to cut his nails, especially the big ones in the toes. Big toe nails used to be very hard that he could not cut it with a nail cutter, so he had to use a knife. So I will ask you to actually, cut your nails and your shaving, every week or at least once in 15 days. How can I learn Ayurveda philosophy like Panchamahabhuta Siddhanta? Could you recommend a few good books? I would say you can get, if you want to get the Panchamahabhuta part of it, there's a book called Tarka Sangraha, or you can also get into the Sankhya and Vaisheshik philosophies where it deals a lot about Panchamahabhutas and, stuff like that. So Tarka Sangraha is actually a very small, good book. Okay. Or you can go online and look for Pada Artha. So Padartha Vijnan. It is a combined textbook which Ayurveda students learn in the first year, okay, to understand the philosophical part of Ayurveda. Padartha Vijnan. Okay. So my weak Agni is solved by eating less. So what should I do with Chiruvilvadi Kashayam? Should I take it? I don't see. I think you are stuck with the part that you got okay with only cutting your food by half. In my opinion, it is a temporary phase. Okay, the moment you cut your food by half, the body recovers a little bit. But if you don't take care of other things, it can again get bad. That's what I want to tell you. So Chiruvilvadi Kashayam. Now we come into Chiruvilvadi. Chiruvilvadi Kashayam is something which will help increase your Agni. There is no other Kashayam in Ayurveda which has been mentioned so specifically to increase the Agni. It is also, mentioned in hemorrhoids, Chiruvilvadi Kashayam, and also fistula and stuff like that, where the main reason for piles and fistula is extremely manda agni. So Chiruviluvadi Kashayam is amazing. I would not say that you have to stop it. If you have got enough with you, I would say you can just take it and finish it off. It will definitely help you. I always sleep better without oil on my hair compared to days I sleep with oil. So I don't recommend anybody to apply oil on the head and sleep overnight. Nights are dominated by moon. There is always a chance of you getting congested. Okay, shift to morning. Does ama cause sleep suppression? Because I notice that when I feel hungry on times, I get sleep on proper time. Ama is not something which is not a good thing. It is bad increased kapha. So when you have got ama, you feel sleepy. It's not proper sleep. It is improper sleep. You feel heavy and you want to lie down. Okay, so that is not good. So getting the ama out of your system is what we have to focus on. For that, there are a lot of ways. Langhanam is the best thing what you can do. That means cut down on things, especially on food and drinks and stuff like that. The moment you cut down on that, the fire actually starts burning what is there. Plus whatever has been accumulated, all those things happen and you start feeling lighter. But if you continue that for longer time, what will happen is your body will feel so light that you will start losing your sleep. So there is the right balance which you have to hit. Okay, sarva dharmeshu madhyamam. So trying to understand what your body needs according to season, day, your work, and whatever you are, your prakriti and all those things. If you know that, then hitting the middle path is what we call as health. Okay, so initially when you've got ama and stuff, when you start cutting down on your food and do langhanam and stuff, you'll feel really light. You keep on continuing doing that, your body will start becoming denourished and your vata will again start going up. So hitting the right balance, Teshamurti, is very important. Besan plus ghee plus sugar plus besan, which ingredient is hard to digest here? Besan is not easy to digest. Okay, it might be the heaviest. And it also depends. See, it's not about guru or laghu. If something is heavy and you take a little bit, it will digest. If something is not heavy, but you take it in large quantities, by the sheer quantity, it becomes difficult to digest. So it depends upon how much quantity you're consuming, Tejaswamurthy. So I can't tell you from this, but when you look at if you take 5 grams of all these, I would say besan might be the most difficult to digest. I'm fine with no stress or poor lifestyle, but as I will avoid oiling and leaving at night. Yes, Priya, I think you can do that and let us know how you feel. Okay. I have noticed persistent dark circles under my eyes. My iron levels are chronically low, more visible after 2 pregnancies. Could you please advise what food and lifestyle changes can I adopt? I think you might be having a condition where if all of you, okay, just this way, okay, if all of you at home are eating the same food, and if your iron levels are not going up, let us come to a conclusion that it is not that the food does not have iron, then everybody should be iron deficient. The food has iron, but somehow your body is not digesting, absorbing, and assimilating the iron. Okay, and along with iron, a lot of other things also might not being absorbed. That's also a possibility. So for you, my approach would be to see that your digestion goes up and your absorption goes up. Okay, then supplementing you with iron and all is secondary if needed, but otherwise it's good to see that your digestion absorption goes up. Okay, Kirtana, hope that makes sense for you. If Agni is strong, will it also burn impurities from mind? When Agni is strong, it will burn impurities from the mind also. Okay, when it is too strong, it will also burn the body. It will also destroy the body. So that is also important. Okay, it's called Bhasma Agni. Agni will also convert you into Bhasma. So it should be in the middle. Okay, Teshamurthy, that's actually a very good question. Could you please type in the name of the book you just recommended? Oh, Padatha Vignan. Vignan spelling might be slightly different for some certain people, but this is the book. Okay. Thank you, Cynthia. Last week I asked what to do for stickiness in cough, and you had suggested Dashamula Kartri and also. Okay. Thank you, Niti. Yeah, it really works wonders, I'm telling you. Okay. Only thing is that you should basically be aware of the contributing factors also. You can't take these kashayams and you can't have every kind of food and expect you to be okay. It is not the medicine only that cures you. Like I said to Tejashri Murthy, it is your ahara, vihara, vichara, and then aushadha. Okay, so aushadha works really well if you are focused on the above three, and if you're focused on the above three, your medicine works faster. So good. Thanks for that share. We're coming to the end of today's session. Normally it is said that we must eat during pitta time, but when we go to gym at 6:30 a.m., it is kapha time. Can I have pre-workout snack like snow almonds, walnut raisins, or a banana? I am not a huge fan of any of these things to be consumed on empty stomach. Okay, I would say it again depends upon on what purpose are you going to the gym. If you are going there to basically get fitter and probably tighten your body, then I would say, see, exercise is normally done during the kapha period. So I would recommend that you don't have to take anything while going for a workout. If you are probably going there to build muscles, okay, bodybuilding stuff, then how do I put it? I would not say bodybuilding is exercise. Bodybuilding is a sport. Then you have the pre-workout, then you do something during the workout, then you drink something post-workout, then you do a lot of things. Then it is not exercise. It is a routine, different kind of routine. You're focusing on something else. Too much of protein might be 4 eggs, 5 eggs, 6 eggs. Some people eat 100 grams, 200 grams of chicken. Then it is not health. In my opinion, it is bodybuilding, it is sport. Okay. I don't know whether I'm being politically correct over here, but that's the way I look at it. So if you're eating moderately, okay, then you have to only exercise moderately. The exercise is basically to stay healthy, not for the six pack or the big muscles and all. That is a designer body, okay? That is a sport. For that, then you have to have the pre-workout, you have to have, and that's a different thing. Then I agree to all those things you can do. Okay, but otherwise, have just a little bit of water and you can go and you can do a workout and come back. Is having a good digestion and good absorption the same thing? Okay, no. See, even, having appetite, having good appetite and having digestion also are two things, Well, Ayurveda says Deepana is different from Pachana. You understand that Deepana is you feeling hungry to eat, and Pachana is basically digesting it. So Deepana, Pachana are basically two different things. Everything that is Deepana need not be Pachana. I hope you're making out the difference. Okay. So, okay, like when you say, taking a shower. Now, when you look at activities, taking a shower is actually Deepana. It will make you feel hungry. That doesn't mean that after food, when you take shower, it will help the food digest. It is the opposite of that. Same thing about exercise also. Laghavam karma samarthyam deepto agni. Doing exercise will increase your appetite. You'll feel hungry. But you do exercise after food, it will not help you. So both are different. Just because you have appetite and you're able to digest does not mean that you are absorbing really well. If your absorption is not really well, there is a condition called Grahani Roga in Ayurveda. Okay, entirely different. Good question. Okay, so we come to an end. We will see you next week with some other topic. Okay, so namaste. Good night.